Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Before we get back to today's subject, I'd like to take a moment to thank our friends here at the Hilton Garden Inn, Park Place, for allowing us to tape our show here today. Enjoy Hilton's great guest rooms and suites, pool and fitness areas, and all hours in the park, restaurant, and bar. The Wisconsin Department of Health Services reports that compared to the Wisconsin state average, Milwaukee County has the greatest number of asthma emergency room visits in the state. Even more alarming is that according to Fight Asthma Milwaukee, 85% of the 30,000 children in Milwaukee who suffer from asthma are African American or Hispanic. My next guest is Dorian James. He's a respiratory therapist at Palmetics Asthma Care Center located right here in Milwaukee. Hello, Dorian.
Hello.
Thank you for being here. And asthma, needless to say, is a chronic or lifelong disease that can be serious, even life-threatening, and there is no cure, but the good news today is that it can be managed. So if you could, first and foremost, give us a background of your treating asthma patients.
Well, my treating asthma patients and learning about asthma started when I was at St. Joe's Hospital. I was working in the emergency room, and of course the emergency rooms see a significant number of not only asthma patients but repeat asthma visits from those very same patients as well. And so I started to study about this condition to determine what would be the best way to help patients who frequently are using the ED to manage their condition. And from there, in about 2000, that's where the asthma program at St. Joseph's has started. They moved it to St. Michael's in 2006, and when St. Michael's closed, they closed the program as well. And about 4 years ago, I had an opportunity then to restart the program under my own direction. And so now I have the only independent asthma program that was developed to address disparities in asthma care and structured to overcome the negative outcomes that have been produced traditionally in this city.
Wow, congratulations on being able to accomplish that. It's interesting when you talk about the number of emergency room visits, a lot of them are asthmatic patients. And so now when we talk about the Affordable Care Act, emergency room visits are playing a role in insurance. So you trying to actually decrease the number of emergency room visits with asthma patients is a good thing when we start looking at the Affordable Care Act, right?
Yes, and when you look at the Affordable Care Act, what they're trying to do is determine how to deliver the best quality of care for the most affordable cost as well. And so currently, because of those repeat visits to the emergency room, a lot of those requiring inpatient hospitalizations, there's a significant cost associated with asthma care. So when you translate better management and decreased emergency room admissions to improved healthcare costs, you're also translating improved quality of life for individuals who suffer from asthma. It's the #1 cause of school absenteeism, has been for the last 2 or 3 decades. And when you talk about how much school is missed by children, even when children are able to attend school, it's very difficult for them to focus in an educational environment when they're having difficulty breathing, because nighttime is a trigger for asthma. There's a lot of sleep disturbance and sleep disruption as a result of that. And so sleep deprivation and fatigue becomes a factor in their education as well. So when we look at improving healthcare costs, that will also translate into improving the quality of life from individuals who have this condition.
And that is part of your goal with your program that we'll talk a little bit more about. But first, want to know what causes asthma. There are a number of things that trigger asthma in those who are sufferers. So what are some of those things?
Well, the primary form of acquiring asthma is through genetics or hereditary. And so there's very strong factors. One parent is 40% chance of having asthma, and 2 parents, you're somewhere between 70 and 80%. A lot of time I've been asked why Milwaukee ranks so high in the nation for asthma prevalence. And so there hasn't been any studies that directly correlate the number of asthma patients in Milwaukee versus the rest of the country, but we do know that asthma exists in highest populations of low income and minority individuals. And if we look at where Milwaukee ranks in terms of low income residents, and then we translate that into the amount of asthma that we have, so I think some correlations can be drawn there as well.
Okay.
And part of that is when low income, the environment that you live in, there's a lot of triggers. Cockroach proteins from their feces is something that can induce asthma in a child that otherwise would not be predisposed to developing asthma. Mice feces as well. And your previous guest from the American Lung Association, the topic was smoking. And one of the things that induces asthma are very young children who are smoking, unborn children who are smoking. And that is the transmission of smoke from the pregnant mother who is smoking, and those products are then transferred into the fetus. And then once the infant is born and they're born into an environment where there's tobacco smoke, if there was no genetic predisposition at all, just inhaling these toxins will alter the development of their lungs to develop asthma.
Wow, and it all makes sense, so I appreciate you breaking that down for us. And I always thought, and I'm sure a lot of people have their own thoughts on, you know, what triggers asthma attacks or things of that nature. I always thought it was hot, muggy weather when kids maybe are outside playing, but cold weather is just as bad as the hot, muggy weather for asthma sufferers. Could you explain that?
Well, unfortunately, Milwaukee is one of the worst environments for triggering asthma. And asthma is characterized by airways that are sensitive to things that they normally shouldn't be. And one of those things, yes, cold air will trigger asthma symptoms. Very hot, humid air, because humidity increases air pressure. But most asthma is also allergic. So then in the springtime, we have the pollens and we have the grasses, and those allergies then trigger asthma. And then in the fall, we have our ragweeds and we have our moles.
It just
and so whatever
a long big cycle.
Exactly.
Yeah, wow. So before we run out of time, Pulmedics, you've partnered with the Allergy, Asthma, and Sinus Center to actually conduct a medical research study that's 26 weeks long, and it's being conducted in over 20 countries. Tell us a little bit more about that.
Well, what this study will do for participants who qualify, who enroll, it's for children as well as adults. It will pay for and cover all of their asthma medications, and it will pay the participants cash money as well. And some of these studies pay up to $1,000 for their participation. And one of the reasons that this study is important, especially in minority communities, is because medications that are on the market, they've been tested in non-minority communities. So we know how they work on non-minorities, but our genetic structure changes from cultures and ethnicities. And so the medications that we want to design for this population that's most affected, we need to study and determine what medications are going to be most effective for that particular population.
Which would explain why 85% of the 30,000 children in Milwaukee who suffer from asthma are African American or Hispanic. You talked about the economic aspect to that, but then also you have medicines that have not necessarily been tested for minorities. So interesting thing there. And so your center is located where in Milwaukee?
We're right on the corner of 86 and Capitol. Our address is 8532 West Capitol Drive, and our second location is 8585 West Forest Home in Greendale.
Okay, so you're on both sides of town, and people can call you and get more information on the study that you've just talked about. Your phone number? Our
phone number is 414-393-4002.
Okay.
And the study is part of the programs that we offer, but the other program is for patients who are uninsured. They have to use the emergency room to obtain their medications. And when you use the emergency room, each emergency room visit brings you closer to your chance of a fatality from asthma. So we have a grant as a nonprofit organization that will provide free asthma medications and allergy medications for patients who are uninsured. Underinsured means patients who have come to us, they're somewhere maybe in that donut hole or loophole, and their co-pays are somewhere between $200 and $300 for each inhaler. So we're able to supply them with the medications that they need, so they don't have to choose between buying their medications or paying their rent or buying groceries.
Okay, and you quickly, we're running out of time. That always happens when we have great
Yes.
information, but this program that you're providing at Pulmedics, you do an evaluation of one's asthma, you have patient education, pulmonary specialists. People can also look further into that and get more
Yes.
information. You have a website as well, right?
That is correct.
Okay, and
That's
that is
pulmedics.com.
pulmedics.com, and we should just keep in mind that, again, he accepts Medicaid, Medicare, uninsured and underinsured individuals for that particular program. So should they consult with a doctor before calling you up? How does that work?
If they call us, we'll make the consult with the physician.
I love it. Thank you so much for
You're
stopping
welcome.
by.
Thank you for
Really
having me.
appreciate you being here. And I know you also have a lot of success stories of individuals who have been able to
Absolutely.
kind of live a better life, increase their activity level, and all those things through your program. So thank you again for being here.
Thank you.
My pleasure. Respiratory Therapist Dorian James. He is a therapist at the Pulmedics Asthma Care Center in Milwaukee. For more information, you can give him a call at 414-393-4002 or log on to pulmedics.com. Another thank you to our friends here at the Hilton Garden Inn Park Place for allowing us to tape our show here in their beautiful lobby. Enjoy Hilton's great guest rooms and suites, pool and fitness areas, and all hours in the park, restaurant and bar. That is going to do it for today's show. I'm your host, Andrea Williams. Thank you for watching, and we do hope you join us again next week as we take a look at our issues, Milwaukee. Have a great day.